Hi, and welcome to another segment on how to live your best life with me, Dr. Paul Machino. Thank you for joining me this month. Hopefully, you're enjoying these videos that I'm making, and I try to provide the most quality information as I can. And hopefully, to this one is no different. As a healthcare practitioner and a practicing chiropractor for over 30 years, I've seen thousands upon thousands of patients in my practice. And the number one complaint that people complain about most is pain. All sorts of pain I've seen: back pain, neck pain, headache pain, shoulder pain, knee pain, hip pain, leg pain, arm pain, foot pain, wrist pain, you name it. I've seen all sorts of painful conditions. I deal with that on a daily basis. People want effective solutions to their problems, to their painful conditions. They want to, get out of their suffering, get their life back again. They want to enjoy their life. So, and I want to give them solutions. And that's my specialty. I mean, I've been in practice for over 30 years, and I treat all sorts of musculoskeletal conditions. I've been trained professionally to do that, and a lot of neurological conditions as well, impingement syndromes and these types of things, pinched nerves. So that's what I've been trained in. And you know what? Over the years, I've done a lot of research and to keep abreast of the relative information that's out there and bring that into my practice in such a way that's very applicable. And I got to let you know that the fact of the matter is, after doing all the research and the state of the research that's out there on painful conditions, the fact of the matter is that there's a lot of confusion as to what really helps with painful conditions. There's really no one consensus as to what is the most effective sort of treatment or care or approach that you can use for a lot of these musculoskeletal painful conditions. There's so many varying approaches that actually work, but there's no really one effective way to do it. And it brings a lot of confusion to the public because there's no consensus. So that people don't know, well, should I see my medical doctor and take medication for this thing? Or should I use some physical therapy? If so, what should I do? Should I see a chiropractor, a physiotherapist, a massage therapist, an acupuncturist, a naturopath? I mean, who do I choose? Do I use heat? Do I use ice on it? Do I use both? Do I use neither? Do I exercise? Do I not exercise? Do I do core strength? Should I hold from core strength? Should I do flexibility? Should I trust what's on the internet? All the information on the internet regarding my condition? Should I? What about cortisone? What about cannabis now? How about diet? I heard diet's very important. How about supplements? What supplements should I be taking? I heard meditation is very good for this. Yoga or Tai Chi. I mean, the list goes on and on and on, and it can be quite overwhelming and confusing for most people who are just trying to get relief. I mean, who do you trust? Where do you go? Where do you find the most effective way to deal with these types of things? Well, the one thing we do know for sure is that all pain should be taken seriously. There is no such thing as fake pain, and there is a cause for it, so it needs to be addressed. So that's what I want to do tonight. I want to address physical pain. I want you to understand why, where it comes from, and what you can do about it, especially in recurrent problems that keep happening over and over again. People are living in pain and they really don't need to. I want to address that and show you how to get out of your suffering and how to live a normal life again. And if you're interested in this, I mean, if you want to learn more about it, you can personal Facebook me on our Facebook page, Live Your Best Life with Dr. Paul Machino, or you can call me at my office, 905-737-0810 for a consultation. Now, the research also shows very convincingly that one of the best things you can do if you are in pain is to educate yourself about pain, why it hurts and where it comes from. And this information I'm going to share with you tonight could really make a difference with people. If you're suffering in pain or someone you know, it can get them out of their suffering and get them on their path to healing. And this information I'm going to share with you is cutting edge information. It's real, it's new. I've coalesced a lot of things together so you truly understand the bigger picture of this, and this type of approach can be quite useful. See, there's an old sort of model of pain that people believe to be true, and I believe that to be true for a long time. And that is that, some type of injury happens or an infection or something happens to the body, and there's tissue damage somewhere in the body. And then there are these receptor sites called nociceptors. They're kind of pain receptors, really. And they pick up this tissue damage and they send a pain signal along the nerve up through the spinal cord to the brain to register as pain in your foot, your hand, your back, your shoulder, whatever it is, wherever the tissue damage is happening, it registers as pain there. And that's what I was taught over 30 years ago in chiropractic college. But we now know that's only partially true. It's much more complex than that. In fact, it actually works like this. Tissue damage happens in the body, and there's these nociceptors in the tissues, absolutely, and they pick up the tissue damage and they send a signal to the brain. But the brain determines what to do with that signal, whether it's going to create pain out of the signal or not. So it's the brain that determines whether you experience pain or not the tissue. That's key. And the brain's only going to create pain if it perceives you're in a potentially dangerous situation. If you sprain an ankle, the brain's going to say, I'm going to create pain there so you don't keep stepping on the ankle and causing more tissue damage. Yeah? So the brain's creating a pain signal to protect you from a dangerous situation. Or it may choose not to create a pain signal. It may say something, may go like, something's more important to address rather than the tissue damage. An example is if you're a soldier and you're in battle and you get your toe cut off, and there's massive nociceptive signals going to the brain to say, tissue damage in the toe, tissue damage in the toe. But the brain may decide, I'm not going to create pain out of that because there's something more important to address. I got to get you out of this emergency situation. I got to get you running across the field to get you out of this emergency situation. So I'm not going to create pain right now. And we see this all the time in emergency situations. People involved with car accidents or sports injuries have broken bones or really bad sprains, and they're able to play the rest of the game or walk away from the car accident and not know they have a broken bone. We see this all the time. They may not feel till after, maybe the day after. All of a sudden they wake up and say, oh my God, I'm in so much pain. Or the brain, on the other hand, may do something completely different. It may say that we may have an innocuous situation with the foot, something that's relatively little tissue damage whatsoever. And the signals that the brain gets from that foot, the brain somehow decides it's a big, huge, potentially dangerous situation. So it creates massive amounts of pain on the foot. So we have these situations where the tissue damage and the pain response are different. And in fact, we found out now, we know that there's a lot of factors that go into creating pain, and tissue damage is only one of the factors. And I see this all the time in my practice. I see people with very little tissue damage have a lot of pain. Then I see people who have massive amounts of tissue damage have relatively no pain or no pain whatsoever. In fact, they do these random MRI studies on people who are asymptomatic, have no symptoms whatsoever, and they find all sorts of stuff wrong with them. They have disc herniations in their spine. They have rotator cuff tears in their shoulders. They've got cartilage damage in their knees. They've got osteoarthritis in their joints. They have degeneration in their spine. And yet they have relatively or no pain whatsoever. Well, the researchers conclude that tissue damage and pain are definitely correlated, but it's not as significant as you may think. Tissue damage sets the stage for pain, but doesn't actually create pain, right? In fact, it's kind of like kindling in a fire. The pain tissue damage is kind of like kindling in a fire. You need other factors to create it into a full-blown fire. So this means that even if you have disc herniations or degeneration in your spine or osteoarthritis in your joints or wear and tear or rotator cuff tears, doesn't mean you have to have pain. I see this all the time in my practice. People present to me and say, I've got this degeneration in my back and in my disc, and therefore I have pain in my back. I say, you don't have to have pain there. I help people get out of pain all the time that have these tissue damage problems. They have these wear and tear, arthritis, or disc herniations in their spine or whatever. I help people get out of pain all the time. How do I do that? Well, I know why this is happening, because there's a bigger picture. There's more factors involved than just tissue damage and creating pain for that person. Well, what are these other factors? Well, they now have redefined pain as a different concept altogether than what they thought it was 30 years ago. Pain is considered a biopsychosocial phenomenon. It's a complex biopsychosocial phenomenon. It involves your biology, it involves your psychology, it involves your sociology. Sure, it involves your biology as tissue damage, but it also involves your psychology, what's happening in your head. It also involves your sociology, what's happening in your social relationships with others. And it turns out that your biology is just one of the factors. Your psychology and sociology are just as important as your biology in creating pain. This means that if you have pain, and people who have pain go see their they're a regular healthcare practitioner. They walk down the street, they go see their medical doctor, or they're a nurse even, or a chiropractor, or a massage therapist, or a naturopath, and they want their pain treated. And these healthcare practitioners are well equipped in how to treat the physical cause of their pain, the tissue damage. But I'm letting you know, they're not well equipped in detecting if there's psychosocial factors involved and how to treat the psychosocial factors. They don't know how to address that. Now, this doesn't mean you have to go through psychotherapy and be psychoanalyzed in order to get better. But it does mean that for some people, they may be only receiving 1/3 of the care they actually need. Now, does this mean that there's no physical cause for pain? Absolutely not. Pain can be just physical. Listen, it happens all the time. Slip and fall, motor vehicle accidents, sports injuries, poor posture, bend and twist. I mean, all these things can cause physical pain, these acute pain symptoms, and they should be treated well. They're treated well by these healthcare practitioners. They're well equipped to treat the physical causes of their pain and the tissue damage that results from it. But if you have cases where, and you're having pain that's of an insidious onset, it just came out of the blue, and you can't really pinpoint anything that you've done, or the pain has become chronic or recurrent where it keeps, it goes away, gets treated, goes away, but it keeps coming back over and over again. I've seen this in my practice where I can treat people, they look great leaving, and then in a week they come back and it happens all over again, or in a month it happened again, and then it happened again, and it happened again, and it happened again, and I keep treating them over and over again. Well, in these types of cases where it's chronic or recurrent or insidious onset, there's usually more going on than just the physical. There's a biopsychosocial phenomenon happening. It's a much more complex understanding or cause for it, and it requires a much more complex sort of approach to that condition. And as I mentioned, if you're interested in this, you can always contact me on my personal Facebook page, Live Your Best Life with me, Dr. Paul Machino, or you can contact me on my number, 905-737-0810. In fact, we now know that chronic pain is a major health problem in the world today. And the number one cause of chronic pain is back pain, followed closely by neck pain and headaches. So we have this model, healthcare model that we use that's very well equipped in dealing with physical tissue damage problems, right? All these people have been trained, and I've been trained classically using the medical model. And the medical model sees you as a machine, a biological machine, which happens to have a mind attached to it. So they treat the machine really well, but they can't really, and they haven't been trained to identify any of the psychosocial factors that are contributing to your pain, or be able to address that in a very well understood way. And that's where I was in my practice over 25 years ago, actually, where I was getting frustrated because I'm doing all the right physical things for the person, but they would keep coming back with similar problems over and over again, and it would keep recurring for them. And so I've done a lot of research over the past 25 years, and it led me to really understand what makes people tick. Understanding how psychosocial factors play a major role in physical pain, and how to address that significantly and effectively. And it's very important because according to the latest statistics that I've come across, we now know that half a physician's patient base has symptoms related to psychosocial factors. That means 1 out of every 2 people walking into my clinic with pain have psychosocial factors related to their pain, and they're not even aware of it. Now, that's very, very important. Now, does that mean that just because you have a high degree of psychosocial factors causing pain, that you can just think your pain away? No, it doesn't work like that. You can't just magically say, well, that pain that I'm experiencing is all in my head, therefore I'm going to magically disappear. It doesn't work like that. Why? Because the part of your brain called the cortex, which is the thinking part of your brain, has relatively little impact on pain. Where most of the pain is contributed from is from a deeper part of the brain, a subconscious part of us called the limbic system, which is where our feelings reside, which is where emotions reside. And that's why you can have people who are very intelligent still suffer from chronic pain. You see, the pain is caused from how we feel about the pain on a very subconscious level rather than what you can think about. That's key. Now, how does this play out in real life? Well, I see this in my practice all the time. As I mentioned, I see people coming in with the exact same amount of tissue damage, but have two totally different responses to pain. I can have a person who's involved in a fender bender car accident and have a little minor whiplash, but be laid up in pain for months. And then I can have a football player who has a very similar impact in their game, minor whiplash, and be, having some relatively little pain for a couple of days, being treated easily, and be back to playing the next football game in the next week. What's the difference between the football player and the fender bender guy, right? They both have the same tissue damage. So is it tissue damage that's causing their pain response? No. Is there other factors involved? Yes. Is there psychosocial factors involved? Absolutely. It's how one feels about what's happening to them rather than what's really going on with them. The football player feels exhilarated by the game of football. So if he gets a little hit from the football, he's like, yeah, this is awesome from the football game. He gets a little minor whiplash from it. He's going to feel like this is just part of the game. I'm a football player, and he's all exhilarated by it, and he recovers really well. Then you have the fender bender guy who's actually threatened by the hit he received and is holding the threat in his psyche on a very subconscious level that's manifesting the pain over and over and over again. It's sustaining him in that pain response. Then you get the poor pain response. So it's not what's happening to them, it's how they're feeling on a deep emotional or feeling level that can be quite subconscious for most people. Because I can ask the fender bender guy, how do you feel about this? Are you threatened by it? You feel stressed about the car accident? No, I just want to get out of pain. He's even unaware of he's holding that hit as a threat in his body. That's how it works. So it's really not what's happening to them, it's how they're feeling on a deep sort of subconscious level about the problem, not what they're thinking about the problem. And so that's why people experience pain. It's really a complex biological, psychological, and sociological phenomenon. It's not just a biological thing that's going on here. It involves your psyche and your social relationships. What's happening between your ears and what's happening in your life in response to the condition you're experiencing. That's key. You understand that? And most people don't even understand it, haven't got a clue that exists. This is very, very important. Now, what can you do about it? Well, let me give you a prime example based on what I've seen in my clinic and how I address it. So to give you an understanding how to address it within yourself. So let's say, this is a true story. I had a patient come to me about 6-7 years ago. We'll call her Sally. And she's a typical case that I've seen with this type of thing. And she presents with neck pain, shoulder pain, and arm pain. And it's been going on for years. And it keeps recurring for years. And it has a sort of she doesn't know why it's happening. And at the worst of times, it can cause pain, numbness, and tingling in her arm as well as headaches. So she goes to see her physician. And her physician says, oh my gosh, this is an important condition. We better send you to a neurologist. So sends her to a neurologist. They do a nerve conduction study. They did an MRI on her neck or shoulder, the whole thing. And they found relatively little, if no, tissue damage in her neck, a little bit of degeneration, but nothing that would cause this amount of pain and discomfort. And her nerve damage wasn't there. It was nerve conduction test was fine. So the physician concludes that the pain she's experiencing is from tense muscles in her neck. Her neck is tensing up, and sends her to physical therapy. So she does physical therapy. She does physiotherapy, right? And they treat it, and they give her exercises. And she also does an ergonomic assessment at work. So she's actually posturally correct. She's got a stand-up desk. She's got the whole thing going on. And she's doing the proper exercise. She also saw a chiropractor who did traditional chiropractic. She also did massage therapy. She did acupuncture. She did a number of other alternative things as well. And I asked her, well, how'd it go? Well, all these things, she said, helped, but only temporarily. I would feel better at the time, but then it'd come back again. And then I'd feel better, and then it would come back. And it keeps recurring over and over and over again. And she was getting really frustrated because I'm doing all the right things, But it keeps happening over and over again, doing all the right exercise, doing all the right things, and ergonomically set up the whole thing. It keeps coming back. So I said, well, this is interesting. It's an insidious onset. It becomes a recurrent chronic problem. There's really little tissue damage that would cause this amount of pain and suffering that she's going through. There must be psychosocial factors involved. So I asked her, well, how's your stress level? And she said to me, well, I'm fine. Everything's good at home. Things are good at work. Everything's manageable. I don't feel stressed. I don't think stress is causing my problem. And this is very common. I come across this all the time. People think that amount of pain that you're experiencing, they have to have a great amount of stress causing it. For instance, there must be a death of a loved one, or some financial crisis they're going through, or a career change, or renovations at home, moving. Something of major stress to cause it. But it's usually not those things that cause the pain. It's usually lying on a subconscious level that people aren't aware of, that's happening on a daily basis, things that niggle away at them but don't really realize it. So she just wanted her pain fixed. I just help me fix my problem, she said to me. I said, well, instead of fixing your problem, how about we take a different approach? And this is what I suggested to her. I said, let's get more understanding out of your problem. Well, what do you mean? Well, I want you to pay attention, keen observation, as to when the pain actually comes on and gets worse, right? What are you doing at the time? What posture are you in? What environment are you in? Who are you with? What are you thinking about? What are you feeling at the time? What are your beliefs? What's on your mind at the time? Yeah? And I want you to pay attention to that and see when it flares up and when it goes down, and see if there's a pattern to that. At the same time, I'm going to do a different approach with you than traditional chiropractic. I can do a whole variety of approaches. I'm going to choose to do a particular approach called network spinal analysis, or network spinal care. And this doesn't involve any cracking, any popping, any pushing, any prodding of the body at all. In fact, it's very light touch. But this approach helps you to create strategies using breath and movement in your body. They're going to help you release the tension in your neck and your shoulder and your arm, and help realign or get the flexibility back in your spine again. And you're going to discover how to create that on yourself. And she was game for it. So I did network with her, and after the session, she would feel better. She goes, wow, my tension I feel is gone. I feel much better. I can move my neck and shoulders. So eventually we did this on a lying down basis, face down. Then eventually we did it seated and standing, so she could actually become more empowered, because it's a type of care, it's a type of learning. She now can learn how to do this on herself. That helped her sustain the changes within her body. So she felt tension coming onto her neck and shoulders. She could use breath and movement in such a way that could actually release it in a few breaths. That was very impactful for her. But I wanted her to discover exactly why it would happen in the first place. Why would her neck start to get tense and cause this pain for her? And during this time, it took a bit of time, she eventually found the source of her problem. What was actually triggering her neck pain, shoulder pain, headaches. And she said that it was because she was shouldering responsibilities in her family. See, she had an elderly parent who needed care. Now, she was happy to do it, but what she felt was, and so therefore wasn't causing her stress, because she was happy to care for him. But what was causing her stress was that she felt like she was becoming overly responsible for him, because her other siblings weren't chipping in the way she was with her family and to help care for him. And every time she became overly responsible, she'd feel the tension build in her neck. But she could breathe it out and release it. It was amazing to her that she could actually create the tension just by thinking about taking care of this elderly parent, and actually take it away with breath and movement. So her painful neck and shoulder and arm pain weren't a condition anymore. It was totally manageable. She was free from the condition she presented to me. In fact, she said to me, instead of being an adversary to me or being obstructive to my life, it actually is an ally and instructive to a better life. So I understand why I can choose differently. So I started to feel that tension coming. I go, no, I know that I'm becoming overly responsible. I need to back off or ask for support or do something. And she was able to manage her condition and manage her parent in a much better way. Now that's huge. That's huge. So I could share many, many, many cases like that. Hundreds of thousands of cases over my 25 to 30 years in practice. And the point is that there's a definite mind-body connection happening and people aren't aware of it. In fact, we now know that 50% of painful conditions have a mind-body connection to it. I'd say it's even greater than that in my own experience, but statistics show 50%. I'd say there's more than that going on because I see it all the time in my practice. And this is very important. If you don't know that that's happening, you don't know that there's psychosocial factors involved with your pain, then you could suffer from pain for a long time. You could be having osteoarthritis, degeneration in your spine, disc herniations, shoulder pain, and the arm pain, and you could be suffering all the time knowing, well, that's nothing I can do. I just have to take, medication in order to get through it. But that's doesn't have to be the case for you. There's other ways around it. So, if you're interested in this, you want to learn more about it, you can personal Facebook me on my Facebook page, and at How to Live Your Best Life with me, Dr. Paul Machino. You can call me at my office, 905-737-0810, if you want a personal consultation. If you want to tune into our YouTube channel, it's here for you. Just plug in Dr. Paul Machino into YouTube, and all my videos will show up for you, including this one. And that's all I want to share. Thank you for viewing the video. Thank you for attending and watching. I really appreciate you watching. And until the next time, this is me, Dr. Paul, signing out, saying live your best life. Thank you.